Welcome back to Better Arizona. I'm Sarah Karlstrom. We're here at Cardiovascular Consultants in Phoenix. We talk a lot about heart disease on our show because it's the leading killer of both men and women. Well, today we're talking about cholesterol and why it's so important to detect it, prevent it, and to cure it. Okay, we're talking about cholesterol. I'm here with Dr. Jeffrey Greenberg. And you know, everyone knows what cholesterol is, but many of us don't really know the bottom line. Why is it so important?
Cardiovascular disease, as most people know, is the #1 killer of men, but it's also the #1 killer of women. In fact, it kills 10 times more women a year than breast cancer. Most women are very concerned about getting mammograms. They also need to be checked for cardiovascular disease. And cardiovascular disease is very preventable and very treatable.
Okay, so how does that connect with cholesterol, and who should be having their cholesterol checked?
Checking cholesterol is very important. I believe everybody, whether they're 25 or 85 years old, should get their cholesterol checked because it's something we can treat. It's something we can do to reduce the risk of both heart attack and stroke.
Okay, so we hear about cholesterol levels a lot. What is the cholesterol profile? What is high? What is low? What are we looking at?
This is very important information. A lot of times my patients will tell me their cholesterol is high, and that's their total cholesterol. And that number in itself is not very important. What we need to know is the breakdown of the cholesterol. And there's 3 parts that are very important. There's the bad cholesterol, the LDL, that clogs up the arteries. There's the good cholesterol, the HDL. And then there's the triglycerides, which are the fats in the body. And it's important to know all 3 numbers, because if any of them are out of whack, all can all cause problems.
Okay, so let's talk about solutions. So if you do have high cholesterol, tell me a little bit about drug therapy. And when you talk about drugs, period, I want to hear about the side effects connected with that.
Absolutely. Drugs are very important. There's a lot we can do now to reduce the risk of both having a heart attack and stroke. And cholesterol medications or statin medications are a big part of it. They go by many names now. Several are generic: lovastatin, pravastatin, simvastatin. Others are brand name: Crestor and Lipitor. But all these medications have been shown to reduce the risk of having your first heart attack, and they've also been shown to reduce the risk of having a repeat heart attack. You've already had one. They've also been shown to help reduce the risk of stroke. And they all can be used to help reduce this risk. Clearly, though, there are side effects. 2 of the bigger side effects: they can cause muscle aches. And I'm not talking about arthritis type pains. They can cause sort of a generalized muscle ache in the body. And if this happens, we just stop the medication and it goes away. Traditionally, we've been taught that we need to watch the fat in our diet. And for the most part, this is incorrect. It's more important that we watch the sugar or that we watch the carbohydrates. In fact, the best way to naturally reduce your risk, your cardiac risk, and your cholesterol numbers is to lower the amount of sugar you eat in your diet. They put sugar in everything these days. My rule is, if it's white, it's probably bad for you. Whether it's white sugar, white bread, white rice, white pasta, and significantly decreasing these carbohydrates in your diet can have a big impact on your cholesterol profile.
Okay, and doctor, you said to me we're talking about cholesterol. It's so important. You can detect it, you can prevent it, and you can treat it. So it's something that you can actually do to help yourself, because if you have high cholesterol, you can't feel it.
That's the whole key, and it's something that's absolutely very detectable, whether it's through testing or whether it's through arterial imaging. It's all stuff that we can do here in the office. We can detect it actually at a very early stage and then treat it aggressively.
Well, great information. Thank you so much. If you want any more information, you can go to their website at cbcheart.com, or if you want to make an appointment and come on in and get yourself checked out, you can call 602-867-8644. Dr. Greenberg, thank you very much.
Thank you.
Better Arizona. We'll be right back.